pregnant or planning to be and struggling with headaches or TMJ pain, this video is for you. I'm Katie. I'm a structural massage therapist of over 20 years, and I specialize in head, neck, and jaw pain. I love teaching people self-relief for head, neck, and jaw pain so much that I've created 2 online video courses teaching exactly this. I also really love to work with prenatal clients. A lot of pregnant clients tell me they don't want to take medication unless the jaw pain or headaches is about a level of 6 out of 10 in the pain scale. But even that level of pain is miserable, especially when you're pregnant and just trying to get through daily life. Often they are very treatable without meds. When we work on the muscles like the neck, the masseter, and the temporalis through professional massage or even self-massage at home, that pain can usually drop down to a 2 or 3 out of that 10 pain scale. And even that shift matters. It can mean avoiding medications altogether or using a lower dose over-the-counter option instead of a stronger prescription. Small changes in how your body functions can make a big difference in how you feel and how you navigate your pregnancy and move safely and comfortably. Hormonal changes in pregnancy affects ligamentum laxity. Basically, that's your joints getting looser during pregnancy. This is thanks to hormones of relaxin and estrogen, which are designed to help your pelvis expand for birth, but they affect all the joints in the body, not just the hips. That includes your TMJ, which is the jaw joint, as well as the neck and the spine. So if you already have a problem and history of popping, clicking, or instability in your jaw, those symptoms can flare up or get even worse during pregnancy. With those clients, I often teach a technique called jaw tracking to help retrain the joint's movements and build more stability. I always want to look at what might be feeding into that problem, and that's what we call perpetuating factors. For many people, that includes how they're sleeping. That's the position of the head, the neck, and even how the jaw is resting during sleep, and that can make a huge difference. Pregnancy changes so much about how your body moves and functions, your center of gravity, how it shifts, your sleeping positions change, and even your breathing patterns adapt. All of that can quietly build up into chronic tension in the neck and the jaw. By that 3rd trimester, there's simply less space inside your torso. As the baby grows, they press upward underneath the ribs, and that pressure on the diaphragm and the stomach reduces how much room your lungs have to expand. These are reasons why so many pregnant people feel short of breath or tight through their upper body. When I'm working with someone in late pregnancy, one of my goals is to influence the breathing muscles of the torso, not just the belly, but the ribs, the back, and the sides. I'm also trying to create more vertical space here so the baby has more room to come out here instead of everything being pushed up and under and crammed under the rib cage. That space helps you breathe more efficiently with the diaphragm instead of relying on the neck muscles like scalenes and SEM, which are really only meant for emergency breathing and not your daily life breathing. If those muscles are overworking, they'll feed the headache cycle and jaw tension and even into some shoulder pain. Just a little soft tissue work here and awareness can make a big difference in how your body breathes and functions in that final trimester. When you breathe better, you also have more energy. Pregnancy can affect your breathing at night. If you have undiagnosed or even mild sleep apnea, it can actually get worse during pregnancy. Increased weight, fluid retention, and hormonal shifts can all cause swelling in the nasal passages or pressure on the airway, which makes it harder to get enough air when you're asleep. Your body will try to fix that problem on its own. Very often, it will instinctively thrust the jaw forward during sleep to open up the airway. You might not have connected it, but this can show up as nighttime grinding or clenching, causing those morning headaches that are hard to shake. That constant jaw thrusting doesn't just wear on your teeth. It can irritate the TMJ itself and overwork the jaw muscles. Over time, that leads to pain and dysfunction all through the face, the head, and the neck. During labor, your whole upper body gets involved. Pushing doesn't just use your core. It activates your neck, your jaw, and your diaphragm, especially when you're holding your breath or bearing down. That's why it's so important to address any head, neck, and jaw pain ahead of time. You don't know how intense or how long your birth will be, and the more ease and freedom you have in those areas, the better support your body will have when it really counts. During pregnancy, the gag reflex is often more sensitive. I've seen a lot of improvement happen without treating the few intraoral muscles that tend to set off that reflex. When I'm working with my prenatal TMJ clients, I start with the areas that make the biggest difference: the neck muscles, temporalis, and treating the masseter both externally and intraorally. The masseter is the muscle that what you think of as your cheek. So we work that safe zone and stay far away from any gag triggering areas. It's gentle, it's targeted, and it can make a big impact without ever making you uncomfortable. If your symptoms are getting worse than you can comfortably handle, especially if they're severe, consistent, or affecting your sleep or eating, then it's time to work with a professional. Ideally, look for an advanced TMJ trained massage therapist who can provide both full body prenatal massage and also address the specific TMJ muscles, including intraoral work in the same session. I also have another YouTube video here that I'll mention with tips for working with a manual therapist for TMJ pain. But I don't want you to feel like you're helpless in between appointments. I highly recommend learning how to treat the muscles on your own between sessions, not only for added relief, but added time and money that you get to save during the course of your pregnancy. When you're doing the self-work, remember, use gentle pressure. Hormones really affect the tissue sensitivity, so less pressure can still be very effective. Also, always treat both sides. Even if the pain is one-sided, balance really matters when it comes to your TM joints. To get step-by-step guidance, I'd recommend my online course, Self-Help to Relieve Head, Neck, and Jaw Pain. Here are some of the specific things I want you to do from that course. SEM stretch for the neck, the relaxing head and neck warm-up routine, self-massage for the temporalis, masseter externally and intraoral, jaw and neck stabilization exercises, perpetuating factors, including supported side-lying positions for sleeping is in the video, and the counter stretch to open up your breathing muscles. Plus, in that, I explain how this position and stretch can actually take some of the baby's weight off of your spine and encourage it to rotate properly in that final trimester. All of that can make a big difference in how you feel day to day. There are times that you really do need to get the help of a medical care team involved. If you suspect sleep apnea, maybe you're snoring heavily, waking up gasping, or feeling completely unrefreshed, then I want you to talk to your OB/GYN or an ENT. And if your headaches suddenly get worse or come with vision changes, speech changes, dizziness, or swelling in your hands and face, call your doctor right away. Pain that is consistent, worsening, or just doesn't feel like your normal pattern is always worth bringing up. Pregnancy already asks a lot of you, so you don't need jaw pain and headaches on top of that. I hope these ideas help you feel more comfortable and feel more in control of your own care. Take good care of yourself.